Hi everyone, how are you? In this video, we will discuss about the different drug interactions. Means you don't give these drug combination to any patient. You should always avoid it because it is very harmful for the patient. I will tell you about the reasons behind it. So this video is very interesting and useful for the pharmacology and also for the clinical practice. So let's get started. First of all, the first combination we will discuss about is you don't give the tetracycline with the penicillin. These both drugs are antibiotics and you should avoid to give these drugs in combination. What is the reason behind it? Because tetracycline is a bacteriostatic. It will inhibit the growth of the bacteria, and the penicillin drug is only work on the active dividing organism. So this is very important to avoid this combination. The next combination is don't give the azithromycin with the antihistamine. So azithromycin is antibiotic and antihistamine is anti-allergy drug. When you give these drug in combination, it will cause the severe chest pain and prolonged QT interval when on the ECG. The next combination is don't give the Ondansteron, which is anti-emetic drug, with the Tramadol, because it ondansetron decrease the analgesic effect of tramadol, which decrease the pain. So avoid this antiemetic drug with the analgesic drug. The next combination is don't give the antacids or anti-ulcer medication like omeprazole with the iron, because what is the reason behind it? Iron needs the acidic media to be absorbed, and we already inhibit the acid media by the omeprazole. The next combination is don't give the metronidazole with the warfarin. Metronidazole is anti-amoebic antibiotic, different uses of it, and warfarin is the anticoagulant drug. So metronidazole inhibit the metabolism of warfarin by blocking its enzymes, so it will lead to the fatal bleeding. So always avoid this combination. The next combination is don't give the furosemide, which is available in the market in the Lasix, the diuretic drug, with the gentamycin, which is antibiotics. So what will cause it? Because it may lead to the hearing loss, hirsutism. So avoid these drugs. The next combination is don't give the non dihydropyridine, which is calcium channel blockers, verapamil and diltiazem, these drugs with the beta blockers, because it will cause the severe bradycardia and heart block and patient will die. So always avoid this combination. The next combination is the sildenafil with the sublingual nitroglycerin. Sildenafil and sublingual glycerin, because both drugs cause the vasodilation, so it will cause the severe hypotension and it will lead to the death. So avoid this combination. The next combination is the calcium channel blocker nifedipine or any other drug which ends with the dipine, like amlodipine, nifedipine, nisordipine with the nitrate. So both of these drugs cause the vasodilation like the previous combination, and it is called the severe hypotension. The next combination is the omega-3 with the antiplatelet or anticoagulants. What will it cause? If we give these drugs, it will cause the bleeding and it is very harmful for the patient. The next combination is the statin, which is HMG-CoA reductase inhibitor, and next one is the Gemfibrozil. Both it will cause the myopathy in harmful for the muscles, so avoid these drugs. The next combination is the antibiotic. Different antibiotics like the ciprofloxacin, clarithromycin, cimetidine, erythromycin with the theophylline. These drugs, when you give in combination, it will cause the it will inhibit the metabolism pathway and increase the level of the theophylline in the blood, which it will cause the death. So avoid this combination. Next combination is the warfarin with the NSAIDs, non-steroidal anti-inflammatory drugs. It will cause the increased risk of the GIT bleeding. We already know the warfarin is the anticoagulant drug. So next combination is the potassium sparing diuretics, which is the amyloid or spironolactone, and with the ACE inhibitors, angiotensin converting enzyme inhibitor, which is the captopril. You should avoid this combination because the potassium sparing potassium will remain in the body and it will cause the hyperkalemia. So avoid this combination. The next combination is the omeprazole with the clopidogrel, which is the antiplatelet, and omeprazole is the anti-ulcer drug. So when you give these drugs, it will cause the clopidogrel hepatic enzymes inhibition, and it will decrease the metabolism of clopidogrel, and it will remain in the body and it will cause the harmful effects. The next combination is the ondansetron, which is available in the market, the zofran, which is the safest and the most anti-emetic drug which is used in the children, and it is very safe. You can use it. The next is the fluconazole, which is the antifungal drug. You should always take this drug with the fatty meal. It will help you to increase its absorption. The next drug is the all breastfeeding babies should receive the vitamin D supplements until the age of 1 year, so it will be very beneficial for the babies. The last one is when you prescribe the sildenafil, which is available in the market, the Viagra, because it is useful for the treatment of the pulmonary hypertension and it will improve the libido. But you should always avoid this drug given with the nitrates or the nitroglycerin. It will cause the hypotension, or it will lead to the death. So I hope you will like this video helpful, and if you have liked this video, please comment if you have any question and share it with your friends, and subscribe our channel if you have not subscribed it, and you can follow our social media platform. Links are given in the description.